Knee surgery can be a life-changing procedure for so many people, but there is an unpredictable complication that affects as many as 6% of knee replacement patients, a painful buildup of scar tissue called arthrofibrosis that can lead to more pain and more procedures. WSJ Assistant Managing Editor Laura Landro joins us now with the story. Welcome, Laura. Great to see you. First off, how common is knee surgery in the U.S.?
Well, it's about 720,000 almost, according to the CDC right now, but that's supposed to go to 1 million by 2020, and then 3 million. It's all those aging baby boomers.
I was going to say, is this a surgery that tends to hit, what, in our 50s, 60s?
Well, particularly if you've been really active and athletic. I mean, one of the downsides of being in shape is you can sometimes, musculoskeletally destroy yourself.
That's right. So what is the cause that most people need knee surgery to begin with? It's just the ligaments have worn
wear and tear, and it's
right.
just, your joint isn't working for you anymore. And so they end up with these total knee replacements, and sometimes it's ACL or meniscus repair. But the bottom line is, for a significant percentage of those people, about 6%, which is, thousands of people, tens of thousands of people, they develop this scar tissue. And one of the reasons they may do so is genetic. And they're doing some amazing research at the Mayo Clinic to sort of identify whether you or I are more at risk for getting this scar tissue.
Is this the same kind of scar tissue that can build up after any operation, or is it specific to knee surgery?
It actually can happen in other joint surgeries, but the problem with the knee surgery is that that's, you really need that to get around.
Of course.
And of course, there are more ways now that they're figuring out how to deal with this.
So is there anything right off the bat that a patient can do to try and prevent this?
Of course, you can do your physical therapy. Sometimes it hurts and you don't want to do it. You have to really do your rehab. Sometimes anti-inflammatory medications can help. But what a lot of they're looking at now is ways there's something called manipulation under anesthesia, where they put you out and then move your knee around to try to break it up. And then they go in and either openly or arthroscopically try to clean it out, but then it builds up again. So they're now looking at new ways of surgery to do this.
So you do have to go back into surgery a lot of times.
In some cases, if you really got it severe, there's a few very interesting things out there, including something that we found at Weiss Memorial Hospital in Chicago, where they radiate the knee a little bit to sort of, and that's been done in plastic surgery, it's been done in hip surgery to prevent scar tissue buildup afterwards. So it's a very low dose of radiation followed by, in some cases, the replacement of that knee joint with something that's a little more stable and maybe won't build up as much scar tissue afterwards. But the problem is, what happens, how do you sort of identify people? So maybe you go in there before you do the surgery in the first place and you do some things that will prevent that scar tissue from building up.
Have they figured that out? How to identify people?
Well, they're working on rabbit knees, which is really interesting, and they're putting things like anti-inflammatory sponges in there before you get the knee surgery, and they're doing looking at putting placenta over the knee.
Wow.
Lots of very interesting things going on at some of these major centers.
All this talk about knees is making my knee twitch.
Well, exactly, and some of the patients I talked to, one of the guys who went through the surgery, Gene Farnett, he was 61 years old, and he had literally gone from 40-mile bike rides to barely being able to walk with a cane. He said he felt like he was 85, and he went in and saw Dr. Henry Finn at Weiss Memorial Hospital. And, he went from Rochester, New York to this place sort of in a desperation. He really found out about this new thing. And people are willing to try some of these new things that haven't yet been widely used, but they're starting to get some relief.
Absolutely. I mean, like you say, the pain can be debilitating, and I'm sure no one you spoke to regrets having the knee surgery, correct?
Well, I think they don't regret it, but frankly, if you end up worse off than when you had the knee surgery, before you had it. So
that even happens if they have the post-surgery procedure? They can still end up worse off?
Well, what they're finding is if they have these procedures to fix it, the scar tissue can build up again. So there's a ton of research going into this at all the big hospitals, at Mayo, at the Hospital for Special Surgery in New York, at University of Chicago, Weiss, where Dr. Finn works. There are quite a lot of people looking at this, because it's not only, the older people, but it is all these young people who have long lives ahead of them in which they need mobility.
Sure, let's all take care of our knees. Oh my goodness, Laura Landro, thank you so much for that.
Thank you.